Good morning, ladies and gentlemen. Today we are going to discuss about the National Mental Health Policy, and in there we are going to understand what it is, to describe the guiding principles of the National Mental Health Policy, explain the components of the policy, examine its state in South Sudan, and describe some challenges and opportunities that we have in implementation of a national mental health policy. So, basically, a national health policy is a comprehensive framework that is established to guide, to regulate, and promote mental health services, their awareness, and to support mental health service delivery across the entire population. So, it's basically a guiding tool and a regulatory tool that makes the implementation or the service delivery of mental health services across the entire population easier, effective, and efficient. And the objectives of a national mental health policy is to address and enhance the mental health services, to prevent mental illnesses, and to focus on provision of effective treatment and support. The core components of a national mental health policy, or what it focuses on, is to prevent, and in prevention of mental health illnesses we are looking at promoting well-being of individuals, communities, families, and reducing the risk factors that predispose people to mental illnesses. Okay, we look at things like substance use, unemployment, or any other component of the environment that can lead to mental illnesses, but also promoting or ensuring that there is social support in which people can feel buffered whenever they are feeling about to experience those mental illnesses. Then, in promotion, we look at raising awareness, reducing stigma, and fostering resilience. Like we said in the first session, we need to demystify the subject of mental health, because most people relate mental illnesses to witchcraft, to curses, but this is not the case. So, if we raise awareness and create the real picture of what mental health is, of what mental illnesses are, then we are able to foster resilience, but also to reduce stigma within the communities in which people who suffer from mental illnesses originate. Then it also includes aspects of treatment. Remember, for you to effectively deal with mental illnesses, you need to be treated, and this treatment should be evidence based, but also accessible and affordable by all people, wherever they are and whoever they are. It should also focus on the recovery journey. I mean, you do not want to treat someone and they are not healing, so you should also focus on what will they do when they are out of this place, when they are out of that mental illness. How can they go back to work and regain that quality of life and fulfill their potential or achieve their goals in life? Then a national mental health policy should also focus at protecting the rights of these people who are having mental illnesses, because even when they are sick, or even when they are having these mental illnesses, they do not cease to be human. So they ought to enjoy those human rights, the rights to the right to privacy, the right to life, the right to other basic needs, just as other humans enjoy. So a good national mental health policy is the one that embeds in it human rights for these people who are having mental illnesses. Then the guiding principles or the golden rules of a good national mental health policy include equity. Like we said earlier, we need to make sure that everyone, everywhere, can access the quality mental health care, regardless of their background or circumstance that they find themselves in, and do this by also breaking down the barriers, whether it is barriers of distance, whether it's a barrier of culture, whether it is a barrier of race. So all these barriers should be broken down to ensure that we have accessibility to these mental health services for all. And then, like we said also, it should be evidence-based mental health care, the one that is based on rigorous research, which provides information that is factual, and we are not basing our interventions on hearsay or rumors, but they should be medically verifiable and based on research that can be verified. And a good national mental health policy should also encourage participation. And when we talk about participation, we are looking at the other principle of ethics, which basically talks about autonomy, that an individual should be involved in the treatment or the management of their mental illness if they can be involved. So, and if perhaps they are too ill, at least involve their families, but also the communities, because this is where the people are coming from. Okay, so they need to know what mental illnesses are, and like we said earlier, they need to create a good environment in which these people can live in. Okay, yeah, an environment that is free from stigma, that is free from discrimination and isolation, and an environment that is full of social support for these people to recover quickly. And then all the stakeholders in policy development and implementation, because we need these policies to create a good environment so as to have a better mental health situation in our nation. Um, Also focus on human rights, like we are saying. Even when these people become mentally ill, they still are humans and they need to be enjoying those human rights. Then the other guiding principles, we are still talking about rights. They should also be these mental health services that originate from this national mental health policy should be responsive to diverse needs. We are going to discover in our subsequent sessions that different people can suffer from different mental illnesses. So, a good mental health service or a good national mental health policy should be able to cater for all the different um, illnesses. Okay, if we are looking at the illnesses that pertain to personality disorders, the care that is given to those people should be different from that is given to developmental mental disorders, those that affect people from childhood. Okay, it should be different from those acute illnesses like cerebral malaria. It should be different from things like schizophrenia. So it should be a bit flexible, that it can handle each person in their own way. It should be individualized, the care that we provide as informed by a good national mental health policy, and should ensure that there is quality and safety of the service that is delivered. Someone shouldn't come to the mental health service provider and they go back when they are worse. Okay, they should be able to get quality service and they should be safe when they are attaining the same service. Then it should be recovery oriented. Um, we do not want to treat these people forever, but we should also look at how they go back to their normal lives. And investment in workforce should also be a golden rule in terms of developing a good national mental health policy. And we shall discover in the subsequent slides that we lack healthcare workforce, especially in our country, and a good national mental health policy should focus on the strategies to increase this workforce, to put in place incentives to attract people into the sector of mental health so that we can have a better workforce. Then we should also encourage and support innovation. Innovation can do wonders in terms of diagnosis, treatment, and general management of mental illnesses, but also reporting can be easier when we incorporate innovation in a national mental health policy strategy. Then we also ensure sustainability of effective interventions. They shouldn't be there for a crisis, maybe now that we are recovering from a civil war, and then after that they cease to exist. But there should be effectiveness of these. There should be sustainability of these interventions. So again, when we recap or remind ourselves of the aims, we realize that a good national mental health policy should promote mental health, should prevent the development of those disorders, reduce the impact of mental health disorders at individual level, family level, but also community level, and it should assure the rights of people with mental disorders. So the factors that are addressed ultimately from those aims, they include discrimination and alienation. We look at making sure that there is no stigmatization of these people who are having mental illnesses, but rather they are welcomed and provided the social support that they need in their communities, in their families, or around their workplaces. Then related physical illnesses are also another factor that is addressed by a good national mental health policy. These people sometimes suffer from other illnesses that could predispose them to mental illnesses, or they could aggravate these mental health illnesses, or they could result from the mental illnesses themselves. So you look at illnesses like malaria. If it is complicated, it can lead to cerebral malaria, which will lead to a mental illness. Then, when you look at HIV in its late stages, or if it is not managed well, it can also lead to mental illnesses. Other things like substance use, are also factors that are addressed by a national mental health policy, because with substance use comes other issues. And that is why we are talking about comorbidity, which is a situation of having more than one disease or disorder or illness present in one person. So you have substance use, but also having depression or anxiety. So a good national mental health policy should be having strategies of dealing with these comorbidity issues so that we can have holistic care given to these people who find themselves in such situations of comorbidity. So the guiding principles again for the standards in a national mental health policy, for us to have a robust national mental health policy, we should focus on standards that include optimal quality of life for the people with mental disorders. This means that they should also enjoy the life that other people are enjoying. Okay, these people should not be denied food. They should not be denied other basic needs of life. We should also focus on consumers and positive outcomes. Okay, we should recognize a unique dimension of individuals and their rights. Like I was saying, people are different, even when they are all having these issues of mental illnesses. They are different and they require different and flexible and adaptable kind of healthcare that is delivered to them. Then equitable access to appropriate services. We cannot emphasize this more. We need to make sure that everyone, everywhere they are, they can access these services. Okay, we need to make sure that each and every health facility, especially the public health facilities, can be able to have components of mental health embedded in them, so that it becomes easier for everyone everywhere to access mental health services without having to spend or having to impoverish themselves with those out of the pocket payments for these health services. Then community participation, like I was saying, this will help in designing um, services that are tailored to individual communities, because we have different cultures, and these different cultures require culturally sensitive mental health services, okay? A particular culture might require something that is different from another culture. So when we involve when we involve the communities in designing these mental health strategies, it helps us in achieving that. But also, it enables us to demystify the subject of mental health, and in so doing, we can eliminate issues of stigma and encourage social support within the community. Then we also need informed decision making for us to have better standards of national mental health services. And in this, we encourage research, we encourage looking out for enough data that can be analyzed and give us and show us what we need to do, but which is from an informed point of view. When we use data, when we analyze data and 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 uh, and come out with facts, then we are able to make decisions that are from an informed point of view. Then continuity of care through intersectoral links, as we shall realize, people who suffer from mental illnesses also have other lives that they are living. Okay, they are from workplaces, some are from schools, some are from prisons, some are from industries. So that linkage between the hospital in which this person is seeking mental health services and then where they are coming from, whether it is a school, whether it is a prison, whether it is a workplace, if there is that linkage, then we shall have continuity of care, so that if a person comes to the hospital and perhaps they have been discharged but with some medication, then there is support from where they are going to make sure that this person can continue taking their drugs, can continue to be supported in order for them to recover very fast and very well. Then we also acknowledge that we should have comprehensive, coordinated, and individualized care because people are different. That's why we should have individualized care. The kind of care that a person with depression is going to get is different from the one that a person with a personality disorder is going to receive. Okay, so it should be individualized in that form. Accountability and adequate resources for mental health system is very important, so as to encourage more financing. When there is accountability, then financing bodies can know that there is value for money, and this will encourage them to improve or even increase funding for those mental health services. So for us to have better mental health services, we always focus on promotion, prevention, and early intervention in the face of these mental illnesses. So this can be achieved by having coordinated national and state approaches. And this means that what is being implemented at national level, if we are talking about community mental health services at national level, then this effect should be trickled down to the local levels, okay? It shouldn't be something that stops at national level. If we are talking about affordable mental health services, it should this effect should go down and even be felt at local level, okay? So involves setting of targets to focus on national and state approaches. We should also be evidence-based for us to achieve this promotion, prevention, and early intervention. And this builds on the body of evidence, showing the effectiveness of every approach that we are using in treating these mental illnesses. But also needs to be a long-term investment that recognizes long-term investment in personal, social, and economic well-being. Like we realized in the first session, um, mental illness is always are influenced by those personal issues, the social issues in terms of the support that you get from friends, family, and the community, but also the environmental issues. For example, the economics, poverty, unemployment, all these issues can come together and influence the mental status of a person. So when we invest in in elevating the personal beliefs, in changing the personal beliefs at those individual levels, in trying to counsel people so that they can be in control of their beliefs and emotions, in trying to create a social buffer whereby people know that mental illnesses are things that can be treated, but and they are also not related to curses or witchcraft. Then by creating that social buffer, by creating that social support system, and also eliminating issues of unemployment, poverty, then we are doing a long-term investment, and this will help us to prevent mental illnesses in the long run. Then influencing factors uh, that increase the risk should also be focused on, because mental health is influenced by risk and protective factors in various life domains, like I was just saying. And then for us to have promotion, prevention, and early intervention in a national mental health policy, we need cooperation and partnerships, and effective action requires cooperation, commitment, partnerships beyond mental health services. And this will also occur when there is inclusive approach, which involves the broader health sector, the families of these people, community services, educational institutions, workplaces, correctional services, emergency services, sports, arts, and business sectors. So all these sectors need to come together for us to have a better national mental health policy. Like I was saying earlier, these are the sectors where people are coming from, and these people who are having these mental illnesses are coming from families. They are coming from the community. Some of them are students or pupils. Some of them are working. Some of them are from prisons, those correctional services. Then emergency services also enable us to work on those people who could have got those head injuries and are facing mental illnesses. Then the sports, arts, and business sectors help us to rehabilitate these people. Okay, so involving the broader health sector helps us to make sure that we have a holistic kind of health service, because mental health, the mental health unit cannot be a standalone unit. Okay, it involves other things. It involves the outpatient department, which is going to screen and know that this person could be helped if they go to the mental health unit. It could also involve the lab people who are going to say perhaps this person is having complicated malaria, and they if it is not managed very well, they could end up having a mental health illness. Okay, it involves all the entire health sector coming together to make sure that we have a better mental health outcome amongst these people who are having mental illnesses. So also in a good national mental health policy, we cannot fail to recognize the importance of a recovery vision. And like we are saying earlier, in terms of recovery, we are looking at making sure that after these people have completed their treatment, after these people have received these mental health services, they should go on and enjoy their normal lives. They should be able to achieve their life goals that they have already set. Okay, they should have quality of life outside the hospital. They should be able to work and go on with their lives, and this it involves aspects of inclusion. And here we talk about people seeking similar opportunities and responsibilities as other community members. They should not be discriminated from some jobs, some opportunities that other community members are able to enjoy. So there shouldn't be those workplaces which discriminate them from getting the same opportunities. We should have a supportive environment, which is only created if there is better awareness. Okay, if people know about these mental illnesses, if they know about how mental health is achieved, then we can have supportive individuals, we can have supportive families, and we can have supportive communities where people are able to live, work, and participate in community ventures. Then should also be principle based, whereby we look at personal recovery journeys, the benefit of hope and optimism after suffering from a mental illness, but also contemporary rehabilitation principles that are able to make sure that these people go back to their normal lives after suffering from these mental illnesses. Then we also have goals. Remember, like I was saying, these people who have mental illnesses, they do not cease to be humans, and even their goals of life do not stop when they suffer from these mental illnesses. So we should optimize the quality of life that they live. We should enable them or support them to achieve residential, educational, recreational, and vocational goals. Okay, so that they can go on with their normal lives even after suffering from a mental illness. And then well-being focus, a recovery vision supports recovery journey and optimizes health and well-being in individuals who have recently suffered from mental illnesses. So now we have realized uh, the importance of a national mental health policy, its components, its guiding principles, and we have also looked at how it should incorporate in the recovery vision. So, as you can notice, up to this point, we need a national mental health policy in South Sudan, isn't it? So we need it because the situation is not something. The situation in South Sudan is not something to be very proud of, because as of in 2020, data was already indicating that we have mental health issues of epilepsy and substance use, which were associated with the cause of many outpatient referrals. Okay, so there were many people coming to hospitals because of these issues, which are mental health related, the substance use, and then epilepsy. And epilepsy alone was accounting for 37% of those outpatient referrals, and then substance use at that time was accounting for 28%. And remember, this is at this is also coming at a time when the nation is recovering from years of conflict, and we expect that there will be some significant people that suffer from mental health and psychosocial issues, especially post traumatic stress disorder. We shall be talking about this uh, in detail in the subsequent sessions, but it basically originates from like the name itself, post-traumatic. It originates from past trauma. So those traumatizing events of this conflict and war, people losing their lives and their loved ones, could end up causing these post-traumatic stress disorder. So when you combine this with issues of epilepsy and substance use, it shows you that we need a robust national mental health policy for us to deal with such challenges. But also, apart from the illness burden, we also have issues of service delivery. The capacity that we have is also not enough because of as of November 2021, the Ministry of Health in South Sudan, with support from World Health Organization, was reporting that there were only 12 beds of mental health patients available in Juba Teaching Hospital, which means that there was only one bed per million population available. Okay, that is not a very good number there. Then we also have scarce mental health personnel with only 3 psychiatrists. We have two nurses who are trained in mental health interventions. We have two clinicians. We have 24 non-clinical psychologists who can deliver counseling services. And while that is, of course, as of 2021, the situation has not improved greatly from that. So we need a national mental health policy that can guide in not only facing those illnesses but also strengthening the capacity of these health facilities that are public in nature, and also making sure that we have better and increased mental health workforce. So an ideal national mental health policy for South Sudan would be that which focuses on developing community mental health services so that we can even reduce the people who are coming to the hospital if we can detect and intervene early at community level. If we can if we can increase the social support that people receive, if we can demystify the subject of mental health, if we can have more community outreaches, if we can train more community health workers who can detect and, uh, and 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 screen mental health illnesses at community level very early, then we are going to have reduced numbers of people who end up in the hospital themselves. Okay, so a development of community mental health services should be a big focus in terms of having a robust national mental health policy, but also integrating mental health component in primary health care. At the lowest health centers in South Sudan, we should be having mental health services. Then it should also focus on increasing human resources, like we have just seen in the previous slides. We only have 3 psychiatrists in the whole country. That was as of 2021, but I don't think the situation has improved greatly. So we need more human resources, we need more nurses, we need more counselors who can deal with these mental health illnesses. Then involvement of users and their families is also very important, and we talked about that earlier on. We also need to advocate and promote mental health in South Sudan, and this can be done through having a better national mental health policy to increase the voice of mental health, so that at every level, whether it is national, whether it is local, whether it is international, we can have a bigger voice. We can give it the attention that it deserves. And this will help to increase financing, to reduce the stigma, especially at community level. It will also help us to make sure that we have we have more awareness in terms of mental health and those illnesses. Then protection of human rights of the users should also be incorporated in a good national mental health policy for South Sudan. Equity of access, we talked about that, and for us to have good health services with the required number of health personnel, we need to increase financing. So this includes lobbying uh, either nationally or internationally, and also quality improvement, then monitoring and evaluation that will offer us checks and balances to see whether the interventions that we have put in place use to handle mental health illnesses are working or not, and then the lessons that we can learn so as to improve the interventions. That will only be possible if we embed monitoring and evaluation in our national mental health policy. So we have challenges that are faced. So in the in this struggle to have a better mental health policy, and these include stigma and discrimination which surround mental illnesses. These can be a result of not having enough awareness or advocacy. When the community do not know a lot about mental health, then they end up stigmatizing the people who suffer from the same. Then lack of awareness and access to mental health services. Some people do not know that these mental health services even exist in the public health facilities. So if we can create this awareness, then people will know that even when their friends, their loved ones, their family members have mental illnesses, they have where to run to. Then shortage of mental health professionals, as we've seen, we have few psychiatrists, we have few nurses, we have few counselors, and then in that inadequate mental health infrastructure, you saw from the beds, we do not have a lot of hospitals that can handle mental illnesses, limited funding, and competing priorities within the healthcare system. This can be evidenced from the time of COVID-19, when people were suddenly focusing on only COVID-19, and these mental illnesses and mental health services were not given enough attention. Okay, so the opportunities or what we can focus on to be positive about mental health policies in low and middle income countries include integrating mental health in primary care, like I was saying, even at those lowest levels of health facilities, we should be having mental health services. Then leveraging technology and innovative interventions to expand access to care, which will include screening, treatment, um, uh, the contacting the counselors over online. So if we use the right technology, if we can create innovative interventions, then we can manage these mental health illnesses better and effectively. Then culturally sensitive approaches, like I was saying, different cultures require different approaches in terms of mental health. And if we are going to have a better mental health strategy, then we need to have those culturally sensitive approaches, which involve community engagement so as to address stigma and promote help seeking. Okay, people should not think of these mental illnesses as a result of curses or witchcraft, but they should be encouraged to seek for help in mental health facilities or public health facilities to get the right care. Then advocacy and awareness campaigns to prioritize mental health within development agendas. Okay, at national, at international level, we should always create this advocacy for mental health, so that there can be more attention, more funding, more there is that creation of awareness, so that people know that it is an issue that needs to be attended to. Okay. Then for us to have a good national mental health policy, sometimes we involve the external actors like the World Health Organization with the Mental Health Gap Action Program. We involve the World Bank to fund some of those mental health projects and programs. We have international non-government organizations and philanthropic organizations, those that give out of kindness, like the Bill and Melinda Foundation, the Ford Foundation, Care International. All those help in making sure that we have robust national mental health policies. Then bilateral cooperations between countries or nations can help to also improve those mental health programs and projects, but also in knowledge exchange programs, okay, where we can benefit from the difference in knowledge, okay. So you can South Sudan can link up with another country and learn from them. You have knowledge exchange programs between the mental health professionals between in another country and South Sudan, and then we learn from how they are doing it right. They also learn from how we are doing it, and then we can integrate those lessons to have a better national mental health policy and mental health services being delivered to the population. So the key players in a national mental health policy include the government, which is supposed to design a good and effective national mental health policy, and it does this by, of course, involving all the stakeholders